Welcome back. Building a foundation of health within our community. The American Heart Association is a science-based organization that continues to work for all Americans. It's when it comes to fighting heart diseases and stroke, two of the top killers here in the U.S. I spoke with Sherry Wells, Executive Director of the American Heart Association New Mexico, to find out more about this year's Heart of New Mexico virtual experience, aka the Heart Ball. Sherry Wells is joining us right now. She is the Executive Director of New Mexico American Heart Association. Sherry, great to have you with us.
Thank you very much. It's always an honor to be here.
Definitely. And right now we're talking about a wonderful event, the Heart Ball. It's always been an annual live event. Let's talk about, some of the challenges and the things that are changing this year, kind of having to shift to virtual.
Okay. Well, for the first time ever, we're hosting a virtual Heart Ball. We actually renamed it to be called the Heart of New Mexico Experience. And so it will be a virtual event on November 12th from 6 to 7 p.m. But we're going to carry that same theme throughout the year and have more opportunities for engagement with our sponsors. We also are doing a portion of it honoring healthcare heroes throughout New Mexico. So it's virtual, and I wish we could be together again, but I think it's going to be a really great event.
Amazing. Well, of course, the cause for everything having to go virtual this year is the COVID-19 pandemic. Let's talk a little bit about how the American Heart Association is working and helping in the fight against COVID-19.
So I'm really proud of the work that the American Heart Association is doing. We have been there since the very beginning that we were aware of the COVID pandemic in February, and we actually issued a $2.5 million rapid research grant. We are continuing to work with researchers and scientists around the world in looking at ways to fight the COVID pandemic. But the other thing that we're really doing is that, 44% of people, especially here in New Mexico, have underlying health issues. And so they're more prone to COVID and having more detrimental experiences with it. So we're also concentrating on nutrition security. We are concentrating on mental health, healthy eating, and all the things that we know will help people that have these underlying conditions so that they're more able to stand up against COVID if unfortunately they do catch it.
Yeah. And again, the work continues outside of that for the American Heart Association. Let's talk a little bit about some of the community impact programs and initiatives that you guys are working on here in New Mexico.
Okay, I'd love to talk about these programs because I think that they're so needed here in New Mexico. Nutrition security is one of them that we're working on. We're working on food insecure resources for children. Children miss more school days now. They're having a harder time concentrating. They have hungry stomachs and at risk for chronic disease later. So some of the things that we're doing here in New Mexico, knowing that 17% of the individuals here are living in households below the federal poverty level, almost 67,000 children throughout New Mexico qualify for free and reduced meals at school. But again, not a lot of our children are at school right now. So we are working on initiatives so that they have access to healthy foods in a vital aspect of nutrition security. 823,671 New Mexican residents. So 40% have no or low healthy food access to healthy food in retail stores. In fact, there's a county here in New Mexico that consists of 5 small little towns, and there's only one Quick Stop in that town that has actually started putting fruit and some nutritious snacks in there. So, we're working in the communities to help with that. We are working on initiatives to include healthy options for kids. And then also in restaurants, healthy options in terms of less sugary drinks, and encouraging restaurants to have on their menu things like juice, water, and healthy choices in terms of what they're actually drinking. Some of the other initiatives that we're working on, and most people know us for this one, is hypertension, which we're trying to help reduce the burden of chronic disease. So That's always been an important initiative for us, but we know that 45.6% of those people with hypertension, high blood pressure, that's not being controlled right now. So we are addressing that with programs like working with clinics throughout New Mexico and blood pressure cuff distribution, education. Again, we're finding that a lot of these other communities throughout New Mexico, they aren't aware of their risk and how high the risk is in some of their areas. We're doing some things with Adopt a Clinic and self-monitoring blood pressure stations. Those are just a couple of the initiatives. Another one of our initiatives that we're working on is we're working on vaping and awareness and preemption. We'll be working on those two initiatives during the legislative session.
And quite a lot of work going on. Real quick here, we're running out of time. Sherry, real quick, details on the Hardball once again, and when's it taking place and the dates and times?
And I know we're running out of time, but one thing I wanted to mention, we have a sponsorship called Beyond the Table that people can find at our website, which is AHA/Albuquerque.ejoin.org. And with that Beyond the Table sponsorship, we're going to be able to make a donation to Healthcare for the Homeless. And again, as I mentioned, we'll be doing more initiatives throughout the year. It also includes a 5-course entree to be picked up from either Slate Street or Matucci's. So again, and music at the end of it by Sam Torres. So it'll be a great hour of fun, learning, and an opportunity to support the American Heart Association.
There you go. Sherry Wells, thank you for joining us. We appreciate it.
Yeah, thanks. Bye.